Ahafo Regional Health Director, Dr. Kwabena Boakye, told a media briefing that the second phase of the COVID vaccination program is ongoing. The Ahafo Regional Health Directorate has procured more than 231,000 doses, targeting more than 300,000 residents.
All persons 15 years and above are encouraged to visit a designated vaccination point with a valid identification card to get vaccinated. With vaccines now available and accessible, time for all the eligible population in Ahafo to get vaccinated is now. Notably, ladies and gentlemen, COVID-19 vaccines are safe, effective, and free. COVID-19 vaccines prevent severe illness, hospitalization, and death due to COVID-19. But the battle is not over, and we need to double our efforts.
Dr. Boakye added that under the first phase of the COVID-19 vaccination in the Ahafo region, more than 166,000 vaccine doses were administered to 52,000 persons, constituting 13.2% of the targeted population. Checks among some residents indicate high levels of vaccine hesitancy, as well as non-adherence to COVID-19 health and safety protocols.
The nose masks, I realize people are not wearing it because they feel COVID isn't a threat. But we need to encourage more wearing of the masks because of the new variant of infection.
Different cry.
I think COVID is no more. But if there is some COVID and the solution is the injection, many in Ghana have taken it. That is why COVID isn't serious. It is those outside who haven't taken it.
According to the Ahafo Regional Health Directorate, as of December 2021, the region had recorded a total of 1,061 confirmed COVID-19 cases, out of which 1,029 people had recovered from the infection, while 32 people died.
And already, the accident and emergency unit of the Komfo Anoche Teaching Hospital may have to be closed down following the surge of COVID-19 cases among health staff as currently cases continue. Now, medical director for the hospital, Professor Ahafo Kufiopuku, tells TV3 majority of the doctors have also tested positive as a result, affecting healthcare delivery in the facility. He spoke to Ibrahim Abubakar.
In November, for about 3 weeks, we didn't have any patients on admission. But we have started getting patients coming on admission. And the worst of it all is that this surge is seriously affecting the staff of Komfo Anoche. And you know that the policy is that once a staff tests positive, a doctor, a nurse, or any other staff tests positive, the policy is that that person should stay away for 2 weeks. If you come to the emergency now, virtually all the doctors have tested positive, and they are not coming to work. So the reality is that it's affecting seriously the rendering of service in the hospital. And if you don't take care, and more than half of the staff of the hospital gets affected and are going to stay away for 2 weeks, then it means we have to close down the hospital, which you don't want to. So the public should help us by observing the protocols of wearing the mask and all the time.
And with a surge in COVID-19 cases in the country, some persons are considering suspending their planned Christmas activities. Unfortunately, staying indoors, they insist it is the surest way to avoid contracting the virus. But for others, the virus cannot stand their way to enjoy the festive season.
In spite of spiking COVID-19 cases, most people continue to disregard the safety protocols. A walk through the central business district of Kumasi shows non-compliance to the wearing of nose masks. At least 60% of all suspected cases brought to Komfo Anoche Teaching Hospital in the past 2 weeks came out positive.
Yesterday, we have about 42 cases, suspected cases, and 37 of them were positive. So you can imagine, out of 42 people, only 7 were negative. The rest were all positive. So we are in serious business. By November ending, we were virtually seeing no case of COVID. And so we all thought, oh, maybe God has finally answered our prayers and that we're not going to see another wave. Unfortunately, from the second week of December, we started seeing the cases. And this time they are coming in geometric progression. It means if today it is 2, tomorrow is 4, the following day is 16, and the following day is 16 squared. So that's what we are seeing now.
Between 13th and 19th December, Ashanti region recorded 171 new confirmed cases. Dr. Ahafo fears activities for the Christmas and New Year will be a super spreader for the virus.
If I had my own way, the Christmas festivities and the end year festivities will all be suspended because it's going to be avenues for rapid rises in the number of cases in the country.
But does the surge in cases likely to affect people's planned activities in this festive season?
Honestly, for a survivor of COVID-19, I wouldn't like to joke with my life for the second time. All programs I had in mind have been cancelled. I'm not doing anything. I'd rather be indoor.
I'll celebrate it with my wife, with my family. So I'm not going out. But there's sickness out, so I have to prevent myself and my family.
COVID need no kwade e hot there, but any gender slide beje wa town wa enemu ni ade wa hwe nipa mo ko no mo ba mo fro car nipa do say na she maxi.
Well, the emergency